Yeah. Yes. Question number 17. Diagnostic errors in medicine. Part C. Question number 17. So time is here on the right hand bottom corner, 120 seconds. Your time starts now. Yes, question number 17. Print screen, full screen. Yeah. Question 17. Yeah. Create poll, quiz mode, logical reasoning approach. So A, B, C, and D. Okay. Yeah. Copy post link. Is where you can check your answer now. Yeah. Write down your answer, please. Yes. So how many marks you got, you can write there. Okay. So the answer is D. The answer is D. The answer is D. Yeah. Why the answer is D? You can go through this. Okay. You can go through this now. Option A is not the correct answer. Why? Because the expression is referring to the stage at which this happens, not to the speed at it which happens. Stage, not speed. Remember, it is referring to the stage, not talking about the speed. Option B. Remember that. That's why C is not right. Option D is the correct answer. Why? Because the expression counterintuitive, counterintuitive, counter means against, not what you would expect. You will expect that is intuitive, but you will not expect that is counterintuitive. Okay, counterintuitive. You cannot expect. Okay. So, in relation to the phrase, this latter finding, this latter finding, latter, former, latter, means second time. Latter means the second finding. This is a reference to the end of the previous paragraph where we were told that one study has shown that treatment alternatives are considered before a final diagnosis has been made. In other words, it is not what you would expect to happen. You will expect that will not happen, and what you will not expect that will happen. That's the point here. Why does the writer use the word counterintuitive? Counterintuitive. Okay. So he's testing your vocabulary here. This answer you will not find everywhere. Okay. Why is he using the word counterintuitive? Intuitive means what you imagine, what you expect. Counterintuitive means what you do not expect. Okay. What you do not expect. Counterintuitive means what you do not expect. That you have to remember. Okay. Now here, counter, the latter finding is counterintuitive. First, he was expecting something that is not right. So again, he will go and think about something. Then again, he will do some test and that is wrong. Then again, so latter finding in the end, conclusion, finding. He did not expect. Né? He did not expect. So after 3 or 4, he expected 3 or 4 problems. And those were intuitive. Intuitive means he was expecting. So those were negative. Now, last finding, he did not expect. He did not expect. So that's the point here. Counterintuitive means going against intuition. Okay. So, right. So, now, First, he will start treating. That's not fine. See here. Okay. So, for example, a doctor who has not explicitly considered cancer at the start of a diagnostic process will be much less likely to diagnose it at the end and refer the patient to a specialist. Okay. And refer the patient to a specialist. Try to understand here. This is exactly the same in a diagnostic situation. Right? So, if we see someone behaving oddly in the street, we immediately form an idea as to why this might be. And once we have mentally structured a problem in a specific way, it can be very difficult to restructure it. We point. Okay. So he's telling that's not fine. Okay. So the latter finding is counterintuitive but could not be relevant to the question of medical error. A well understood characteristic of decision making is that the initial hypothesis generation stage is very important. Okay. If we see someone behaving, so that is the point here, it can be very difficult to restructure. This is exactly the same in a mental situation. So, for example, a doctor who has not explicitly to diagnose it. Imagine in the beginning. Okay. So now he will do all the other ordinary tests, whatever he know, because he already decided this is not cancer. So now in the end, what he will do? He cannot diagnose anything. He's out of his reason because he thought it is not cancer. Now he will send him to a specialist. Then that specialist will diagnose it as a cancer now. Maybe cancer. So he will send for cancer test. But he already decided that this is not cancer. Not explicitly considered cancer. He excluded cancer, not possible. Cancer, not possible. Now, why he will do the test for cancer related tests? So, this sort of decisions are counterintuitive. Okay. Try to understand. So, you have to assume, you have to expect. That's the point it is. Productive. So, now let us see here. Now, the point is, so the latter finding means diagnosis. Finding means diagnosis. Okay, diagnosis. Diagnose. Okay. Latter means final. So that means after diagnosis only treatment starts. Okay. After diagnosis only. Okay. A doctor after final diagnosis. But he did not diagnose. He said this is not cancer. and other things. But he already decided that this may not be cancer. So he will not prospect, he will not interrogate the aspects related to cancer. He will do everything else, but nothing will be positive. Then he washes his hand and says, his intuition will work properly. His intuition will work. Maybe cancer means he will go forward, but he may not be cancer, so he will not diagnose cancer. If you are in search of the answer, you will get the answer. If you are not in search of the answer, you will not get the answer. So that's it. See, for example, vocabulary. Vocabulary is very important. If you give importance to vocabulary, you will try to understand the synonyms and antonyms of them. Okay. So intuition, what mind says. Counterintuition means you don't expect that. What you expect, your mind tells. What you don't expect, mind will not tell. So counterintuitive means that's the point. You will not expect those things. So you will not diagnose those things. That's very clear. Okay. So he says, I am helpless. So he will send it to a specialist. Specialist, he will definitely diagnose it very easily. That's the point. Counterintuitive, the meaning you have to understand is where intuition, the vocabulary. Counter means against what your mind says. Intuition. Counterintuition, what your it's against what your mind says. Going to screen. Full screen. Yeah. Yes. So once again, induction, inductive and deductive methods. Learn these techniques. Okay. Now you can see here. Option D is the correct answer because the expression counterintuitive, meaning not what you would expect. So if you expect, then you'll go for it. Okay. If you expect, you'll go for it. If you think that you'll get a good salary, you'll go and apply for that job. If you think you will not get a good salary in this particular job, you'll not even apply. Nah? That's the point. Okay. If you think it is good, you'll go for it. If you think it is not good, you'll not go for it. That's it. That's called counterintuitive. Your mind will not agree with that one. That is counterintuitive. So, meaning not what you would expect is used in relation to the phrase, this latter finding is counterintuitive. This is a reference to the end of the previous paragraph where we were told one study has shown that treatment alternatives are considered before a final diagnosis has been made. In other words, it is not what you would expect it to happen. Initially, first of all, you will go for some tests. Oh, maybe brain, some damage or some hurt or some damage, internal bleeding or something. So then you go for test. Then that is ruled out. Then you will go for some other test. Then that is also ruled out. Then you'll say, maybe we'll test this one also. Then you'll, this is the problem. So because initially you did not think about that one, nah? Your intuition did not say maybe this is what the problem. So that's why you opted for many different things before coming to the final. So these are ruled out, these are ruled out. Okay, let us try for this also. Okay. So this lack of trying in the beginning only is making the delay. Right. So how many marks you got out of 3 so far? Robel got 3 out of 3. Kirti Parmar got 3 out of 3. Lavanya, So all regular students, very good. Thank you very much. Aisha Chetrani, how many marks you got? Okay, fine. That's good. So we'll go for the next question.